Thank you very much, Minister. Our clear and very welcome Minister to the House today. Before I start, I want to welcome the announcement by the HSE this morning that women will be able to have their partners present at anomaly scans. And I've been one of those women who have had the worst news of one of those scans, and it's coming up to the 40-year anniversary of that little person. There's not a day I don't think about them, and it's great that that women who are going through similar and get similar news today and going forward are not alone, and to get that news. But back to the commencement matter. I sent this commencement matter in mainly out of frustration and impatience. I've wondered for many years, out of personal experiences, are women actually being listened to in the Irish healthcare system? In the history of our public health, we have not seen waiting lists like this before for gynae services. In the latest figures from the National Treatment Purchase Fund, it shows that in Ireland there are 4,446 patients on inpatient day case waiting lists for gynae procedures at the end of October of this year, and around 1,200 of the patients waiting nationally have been waiting longer than a year. This has increased by 200 in 2020, and by more than half of that in the past 5 years. The number of people waiting for more than a year to see a consultant has almost doubled in 2020 and increased by more than 1,000 in 5 years. These waiting lists are creating exhaustion for Irish women, young and old. And I wish to highlight a specific illness, endometriosis. The lack of care, diagnosis, treatment for this illness is atrocious, and you can wait up to 9 years for a diagnosis, and that's if you persevere. Don't give up and think that it's just normal. It's not normal to be in pain any time of the month, and endometriosis doesn't just cause difficulty when you menstruate, it can cause difficulty and pain all month long. I suffer with this, Minister, and it so happens that I'm standing here in absolute agony today, and so many women around the country are the exact same as me, and they're going through their daily functions in pain and usually untreated. And there is not enough awareness. I do not think there is enough training. I have heard horror stories from women who are told that it's in their heads to take painkillers or go for a run. Well, now that's very well and good if you're fit to go for a run and you're not crippled in pain. So that is very insulting, to say the least. Something drastic has to be done, and some women are being ignored. Women's chronic pain is being ignored. Illnesses are not being diagnosed and therefore not treated. I am very aware of the HSE's National Women's and Infant Health Programme wanting to help the majority of patients with endometriosis and other gynae problems by improving their access to the gynae services. However, from the previous figures I have stated that there are serious efforts are needed to be given to rectify the demand for gynae services. We cannot help diagnose any patients if there is already this outstanding demand for gynae services. I look forward to hearing the details and action, hopefully from the Minister, on the Department's plan to increase capacity, reduce waiting times for women awaiting gynae appointments, and the update of the phase 1 of the model of care, and to hear the timeline for the opening of the new clinics. Thank you very much, Minister.
Minister.
And thank you, Senator McGreehan, for raising this matter today. And the answer, I'm taking this question on behalf of Minister Donnelly, so the answer I articulate is from Minister Donnelly's direct department. The demand for gynaecology services consistently outstrips supply, with increased waiting lists being experienced across all delivery services. I am advised that an effort to improve access and to ensure a more suitable gynaecology service, the HSE's National Women and Infant Health Programme has developed a new gynaecology model of care, and it is envisaged that the implementation of the model of care will help to reduce the waiting times that you so speak about for women awaiting general gynaecology, which would include patients with endometriosis. The new model of care involves the establishment of a one-stop see and treat ambulatory gynaecology clinics. These clinics will help to ensure that gynaecology patients receive safe and appropriate treatment, reduce the need for multiple appointments, and ensure a more effective use of public funds and improve clinical outcomes. I understand that approximately 70% of general gynaecology referrals are suitable for management in this new setting. Moreover, redirecting appropriate cohorts of women for care in this setting will also bring direct downstream benefits by freeing up scarce resources in our acute hospitals, for example gynaecology theatres, which could then be used for more complex procedures. In addition, given the need for our health service to continue to provide safe and appropriate care in the context of the ongoing pandemic, ambulatory Gynaecology provides a real opportunity to move services into the community setting and avoid the need to bring patients to hospital when COVID-19 might be prevalent. And I think that's really welcome, that we are starting to treat women in their communities and not looking upon the issues that you have raised here this morning as something special that we need to go to hospital for. We should be delivering it in our community settings. I am advised that the rollout phase 1 of the new model of care commenced this summer with the establishment of the first 3 clinics under the governance of the Rotunda Hospital, Dublin, Cork University Maternity Hospital and Galway University Hospital. In addition, more limited clinic is being developed in Waterford University Hospital. I am informed that the ambulatory gynaecology clinics in Cork and Galway are already providing services, while it is anticipated that the Rotunda clinic will be operational in the new year once the necessary refurbishment works has been completed. The implementation of this model of care directly reflects this government's commitment to promoting and improving women's health, highlighted in the programme for government. Indeed, under Budget 2021, funding of £12 million has been provided for maternity and gynaecology services. I am advised that a proportion of this funding will be used to develop up to 5 additional gynaecology clinics next year. And I'm sure, Senator McGreehan, you will be looking to the Lourdes, no doubt, in your particular area. Subject to funding availability and in accordance with the model of care, it is envisaged that up to a total of 19 such gynaecology clinics will be rolled out across the country on a phased basis in the coming years. As this House will appreciate, the development of this key service will help to alleviate the significant pressure on extensive waiting lists for these key women's health speciality. And finally, Ceann Comhairle, if you don't mind, I would also like to welcome the news that we got in relation to partners being able to attend a 20-week scan. I think it was something that all members of the House, both male and female, have articulated since we returned here last September, that there would be compassion shown at special times of one's life, whether it be for the good news or the not so good news, but support had to be recognised, and I do welcome that news today.
It is great news, and as you say, 12 million have been given into the budget for gynae services. And I suppose, you know, we just cannot take the foot off the pedal. There has been good news, and you've highlighted very good news in your speech there. You know, the 3 new clinics and the 19 more clinics to be rolled out. Yep, just we must insist, foot not taken off the pedal. Thank you.
I'm going to read out Minister Donnelly's concluding statement, because that is what I so much do. And to conclude, I would like to emphasise that developing the gynae clinics is integral to improving access to the services and reducing waiting lists for this speciality. I can confirm that the rollout of the new model of care is underway, with a number of the clinics already, as I have said, up and running. Finally, I want to take the opportunity on behalf of Minister Donnelly to emphasise that developing and improving the gynae services is just one aspect of this government's broader commitment to promoting women's health. This includes supporting the work of the Women's Health Task Force, including the development of a Women's Health Action Plan to tackle a wide range of issues impacting on women's health outcomes in Ireland, including relation to the gynae health. The task force priority will be supported by the budget allocation of 2021, an allocation of a dedicated £5 million to the Women's Health Fund. And this funding is in addition to the £12 million provided in the budget for maternity and gynaecological service development in 2021. So you're glad I read out the concluding statement. Thank you.
Thank you.